Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, Mr. Ali, Mr. Lulu, Miss Fatma, and all of my friends. In this occasion, I will present you about mental health. Why taking care of our mental health is important. Okay, so first of all, I am going to ask you guys, how important do you think our mental health is?
Very important.
Very
important.
Very important.
Yeah, in my opinion, mental health is really important. It is as important as our physical health because our mental health can affect our physical health too. For example, when we are stressed out, we are more likely to not eat, or even when we are depressed, we are more likely to hurt ourselves. It is even way worse, from any other case. So in this case, we are it is better for us to take care of our mental health. So we can see the data here. It is from 5 provinces in Indonesia. It is the data from the year 2013 with people who have psychosis and schizophrenia. Psychosis is when someone can differentiate between the real world and hallucination. And schizophrenia, it is when someone gets a lot of hallucination, like pictures in their mind, voices in their mind, and they are mostly commanding the people who suffer schizophrenia to do bad things, like hurting themselves, hurting our other people, like that. So that's why it is better for us to take care of our mental health so we can avoid ourselves from getting or suffering from mental health. So Natasha Tracy, a mental health writer, once said, "A mental health is the only disease that can make you deny its own existence. Certainly, the idea that brain can deny its own illness, it is frightening. It is a frightening thought." What she meant here is when someone already has a mental illness, they are more likely to deny that they are suffering from it. Most people in our generation, especially in our generation, they are they are more aware of their physical health. They tend to ignore their mental health, even though we all know that mental health is also really important, really important. The teenagers from ourselves tend to work out, like they tend to build their physical health, but they ignore their mental health. So why is consulting a psychologist important for teenage? Why is consulting to psychologists important for teenagers? It is, first, teenagers are unstable. Second, psychologists are trained to help people who deal with mental illness. And third, humans' mental health is formed during their teenage years. The first point is teenagers are unstable. Why are teenagers unstable? First, their mental health is still in its transition phase. What does it mean? It means that we are reckless. We tend to make decisions that we don't consider the risks that may come to us after we make the decision. So that's why teenagers need a psychologist or a professional to guide us, to give us advices, to control us, so we can at least we can be controlled, and we can control ourselves from doing bad things that can guide us to having mental illness. The second one, psychologists are trained to help people who are dealing with mental illness. As we all know, psychologists are people who are already trained and guided to during their school years. Back then in college, they are guided to deal with many kinds of people, with many kinds of characteristics, with many kinds of illnesses maybe, and so they are the ones that are they can handle people with many kinds of characteristic. Psychologists, because psychologists can handle this, because psychologists are already trained to handle people from many characteristics. They can be a safe place for teenagers to tell everything they want. For example, when you have a problem in school, when you have a problem with your girlfriend or boyfriend, when you have a problem with your friends that you feel you can't tell your parents, you feel you're too shy, you feel you're too afraid, you can tell psychologists anything you want, anything, because a good psychologists are, they will not judge you, they will not blame you for something that you talk about, because psychologists know the reason why this kid behaves this way, why he is sad because of this thing. Psychologists tend to understand more than our parents, right? Because they are already trained during their school days to handle this kind of thing. And the third point, humans' mental health is formed during the teenage year. So the teenage year is from middle school to high school, right? And during the teenage year, we are most likely to be stressed and pressed, like we don't know what we are going through. When during the teenager, we are most likely to be bullied, we are most likely to feel insecure, we are most likely to feel stressed because of the assignments, because of our friends, because of our relationships with our girlfriend or boyfriend, or even with our family. So that's why, to prevent negative things that can affect our mental health, we need to share our feelings, our thoughts to someone. Someone is professional, someone who is professional, someone who can understand what we are going through, someone who can understand at least our mindset, what we are feeling right now. And that person is a psychologist or a therapist. But if our mental health is already damaged, it is also okay to come to a psychologist. It is never too late for us. Remember, it is never too late for us to come to psychologists and ask for help, because psychologists will give you a therapy session. For example, psychotherapy. So in conclusion, we all need to take care of our health, because since teenagers year, in order to be aware of our mental illness, in order to avoid mental illness to come to us. So that's all from me. Thank you so much. Any question? Hello?
Yeah, thank you, Sherly, for the presentation. Now, please, for those who wants to ask, you can raise your hand now. Okay, the first is from Angelina. Yeah? Angel, do you want to ask something?
Yes. Um, Shirley, from your point of view, what will happen if teenagers with mental health don't go to psychiatrists? Thank
With
you.
mental health issues.
Yes.
Uh, answer directly, sir.
Yes, you can answer it.
In my point of view, if someone who has a mental health issues don't go to a psychologist, it will be really, really dangerous for them. It will it will it will guide them to something that is worse. For example, uh, the first thing that people who have mental illness feel is their mood is they change their moods very frequently, and it affects their focus, it affects their thoughts. So if it is too late, no, not too late, if they don't go to psychologists to seek help, it will guide them to suffer from depression or even having suicidal thoughts. So it will be really, really dangerous for them. It can lead to a suicide. The worst case is suicide. Thank you.
Okay, next. Next question.
Do you think toxic friends can affect our mental health? I mean, like they like to tease us, that hurt us, but sometimes they support us. What should we do if we have friends kind of like that?
Toxic friends. In my experience, toxic friends, I always cut off toxic friendship. Not like I it's not like I am angry at them. No, not like that. It's just I take distance from them slowly, but until when we used to be so close, until we are not that close anymore. Because if we are in a toxic friendship, it will affect our mental state, of course. Especially if they keep doing the same thing again and again and again, it will really, really affect our mental state. And maybe even if they toxic friendship is, there are many kind of toxic friendship, right? The one I have is someone who often talks about the bad side of myself. Like, it often makes me insecure, so that's why I take a distance from that friend. So if you are ever in a toxic friendship, you better cut your friendship with that person. Thank you.
Thank
Thank
you, Sally.
you.
Sally, can you close your sharing screen?
Oh, yes.
Okay, next question from Shauki. Yeah? You raise your hand. Shauki, do you want to ask?
Okay, okay. So, Shirley, can you hear my
Yeah.
voice?
Yes, I can.
Okay, so what do you think if someone has a mental illness, but he or she doesn't want to go to psychologist? So, someone, he or she just tell about their mental illness to their parents. Uh, I mean, like, uh, is it good just to tell to our parents not to go to psychologist because our parents is a teenager in the past.
Uh, I think if someone tells their parents about their feelings about that they are having but that they are suffering from mental illness, it means that someone trusts their parents, and if they feel comfortable talking to their parents like that, and if their parents will find something to make that someone to heal from mental illness, it's a good thing actually, because we can first talk to our parents. At first it will take time, of course, to consider what will they react to us, but if we talk to them and they give us a good response and they support us to, it's okay, like it's okay, we are here for you, like that, it's a good thing actually, in my opinion. Thank you.
Okay, thank you.
Okay, Mr. Dulu, do you want to ask something?
Yeah.
Question?
As far as I'm concerned, there are some differences between psychology and psychiatry. So if you want to enter university and then you want to get a profession as a psychologist, you don't go to medical school. But if you want to be a psychiatrist, you have to go to medical school, fakultas kedokteran. So I think, Sherly, you must differentiate. Okay? If teenagers have problems, where should they consult to? Psychiatry or psychology? So I think
Psychologist.
okay, because previously Angeline had psychiatrist, if I'm not mistaken.
Yes.
Oh yes.
Yeah.
Psychiatrist is a doctor.
Yeah, doctor. Okay. So
Okay.
it can lead misunderstanding. Okay, so you have to
Oh yeah, I'm sorry.
make correction, and then you have to make it clear that there are two different things. You know, psychiatrist and psychology. Okay, yeah. Thank you.
Okay, mister. Thank you.
Yeah.
Okay, maybe the last question from me, yeah. Sherly, why are you so interested in discussing this kind of topic? Why?
Because the first thing that makes me so sure to talk about this thing is because I have a friend. She is older than me, and she is suffering from depression, and she often talks about me about what she feels about that. She wants to hurt herself. She wants to do that bad thing to herself, and that makes me sad because mostly Indonesian people are ignorant about this thing. So that's why we need to talk about this thing more often. So there will be less people, or even no one will suffer from this pain again, because no one wants to, right? No one wants to suffer from depression. No one wants to have suicidal thoughts. No one wants to hurt themselves intentionally. So that's why I really want mental illness to be taken seriously.
Okay, I think any more question? I think that's all, yeah. I think thank you, Sherly, for your good presentation. You did a good job.
Thank you.
And then for the next presentation, I think we should end this meeting first, and then please reconnect again to the Zoom or to the link that I sent to you, because the remaining time only 5 minutes.
Oh yeah.
Okay.
Okay, Mr.